Okay, so thank you, Vishal. And I'll be discussing regarding the OPDs and the wards as has been said. Just a brief regarding this. We all know that this virus spreads, but remember it is more spreading more efficiently than influenza, but less than measles. So it is not that contagious as we think about it, that everyone is going to get whosoever is exposed to it. Death in HCP is a reality, and there's a huge viral load. 13 to 14% of all the people are healthcare providers. The most important fact is most of the surgeons, I would say, have been infected all over. The statistics shows in the OPDs and the wards and not in the operation theaters. Maybe because they are taking a lot of care in the operation theaters, but not so much in your OPDs and the wards. You'll be where you relax and bring down your guards. So first thing is this: patient staff safety, whosoever we are dealing with, starts with me. It starts with the healthcare provider, and he needs to gear up himself to ensure that he is not the person who is spreading it to all the patients and his colleagues. And people who do not understand with this is a beautiful thing which says that take care of yourself, no need of heroics. All you get is a garland either way, whichever way you remain. So remember this is a cynical way, but I think it will hit hard to the people, most of the orthopedic surgeons. You will not be requiring of any heroics. You will only get a garland, whichever you want is your choice. So why do we need protocols? Because most of them are asymptomatic, and that's what we are going to deal with. We will not be knowing who and which patient is having COVID or not. And we might have to assume, if we are in stage 3, that everyone who comes to us can be a COVID candidate. The other thing is symptoms who develop, they already are transmitting before developing symptoms. And at present, we nearly have nearly 30% of false negatives in many of the tests which are there. So we need to have some proper guidelines which are still made right now for our OPD and IP things. As if you look at the CDC guidelines, there are 3 types of protocols which can be made. One is conventional, which we were doing before Corona. The second is contingency, when we have changed our practices, but not in the crisis mode. This is right now what is happening in India, is a contingency capacity building up. And also it will happen after the lockdown, when we will have the OPDs and the wards which will start running to the full capacity. And the third one is, I think what Nikhil was saying, was in the crisis one, when your entire country is in the phase of an extreme infection, which may be most prevalent right now in the developing world, right now what we are seeing. So what we are emphasizing is the contingency capacity, because then only the wards and the OPDs are going to burn full throttle, which will have an impact, and we need to live with Corona. The controls are in a hierarchical system. If you see in an administrative way, this is what is there. The most effective is elimination or substitution of the biohazard, which we cannot do right now. So everything and anything which is remaining with us right now is these 3: engineering controls, administrative controls, and personal protections. Personal protections is the least effective because it individualizes the thing. As a society, more important is administrative, which will be the protocols, and engineering controls, or the structural changes which can happen in the hospitals and in the clinics, which will make our things more safe for everyone involved. And we all know in India, we have government hospitals having some sort of capacity with them, the private big corporate hospitals, and the nursing homes and the clinics. So it's not one system and one protocol which can fit everyone. We all will have to make our own protocols, understanding the stage we are in, whether we are in crisis or in contingency, or we are the hotspot or we are not the hotspots, and where we are working and what we can do. But one thing is clear, that we need special planning, and more funds are going to be diverted to structuring your things right now. You will have to give and specifically allocate funds for these, because this cannot happen overnight. You need to develop and give some funds specifically for this part of expenditure, which everyone in clinic, corporate, and government hospitals will have to bear. As per the thing, if I say before Corona, this used to be the stage of any OPDs in any government or a big private hospital. But now what you need to do will be on the staging of infection. And it's always with Corona, because we are going to live with Corona now. It is not AC or after Corona. After Corona, maybe we do not know when and how it is going to happen. But we are going to live with Corona, where social distancing, marking of the things for registration, even in big hospitals, if they are coming with an appointment or without an appointment, less number of patients is going to be the key while looking at these patients in the OPDs. So we need to understand that. So most important will be that we will have to reduce the walk-ins and do it by appointment. I'll request all the clinicians and the private nursing home people to start disseminating this information if they have not already started doing so, because this is in favor of everyone. That patients, once we used to say in front of my house 100 people are waiting, that's not the issue now. You are with Corona status and era, so you will have to have appointments, channelize them, make them in different parts, and if they must come, they have to be told and asked beforehand what is their history regarding the fever, cough, and other symptoms. OPDs will have to be stopped, and which has already been done right now because we are strategizing. In the crisis stage, it will not be the OPDs, which will be face-to-face OPDs, which we can run. Telemedicine is going to be the key thing, which is going to be more important now. And I think Dr. Nikhil is going to be discussing that in greater details in the future. We'll have to limit the point of entry and exit. The first thing which we need to ensure is, if we are a bigger hospital, we will have to have separate places for COVID and non-COVID. Like in my hospital, a separate building altogether with 250 beds and another associated building has been converted into a COVID hospital. So any patient who comes anywhere is first screened, and once he is screened, depending upon the suspicion or not, they are shifted to various places, like in COVID area or to non-COVID area. Every patient or any personnel, any living thing who comes to that area and a human being has to be having a mask over his nose as well as his face. Preferably a surgical 3-ply one, but even if we can have, because it covers nearly 60-70% of the things, but if not, at least a cloth one which will cover less than 50% of the airborne particulates. If they do not come, we will have to have provision for people to distribute masks, because it is not only for their safety, but for our own safety and the other people who are working in our clinics or in the hospitals. You will have to give sanitizers or hand washes to everyone whomsoever come. So what we are doing is the source control. In a small nursing home, this is what many of the colleagues have been doing. You have a person who is fully the watchman or so, fully protected, or the person whomsoever you are guided, tests the screen temperature, gives them an alcoholic hand sanitizer or washes the hands, gives them a mask if it has not been there, and then only the person who has come with an appointment gets to enter your hospital or a small clinic. The registration counters, if they are there, need to be changed and install physical barriers now. Once we were there, which we were more interactive, we were taught that we need to be closer to them. It should not be the other side of the table. Now, unfortunately, we will have to have those things. There will be physical barriers. You will have to have them in registration counters and other places, just like you go for any US visa or any other place. Questionnaire regarding their status, whether they have any symptoms of fever or so, difficulty in breathing, questionnaire regarding COVID needs to be signed and given an answer by every person who comes. And also a consent might be required. The medical legal aspects can be discussed later by Dr. Nikhil, but I think that a consent from them also regarding infection of COVID or the aspects of COVID with surgeries needs to be discussed with them and got signed, both in their vernacular language, and written consent has to be a must now. Once you have those screening areas where you will have to have social distancing, is going to be, the physical distancing is going to be the new norm. Not the social, but physical. So what I was saying was that if you are suspecting a person, you need to have a separate area if possible for them. You might have to have special ventilation for them, which will be different from the other hospital, presumably, if possible. You can think of a room where you're going to be screening and taking care of those patients. Crowding is a strict no in a waiting area for your OPDs. And most of happen, what you're going to be doing is having these screens, the numbers, which we even have started at our hospital long before, of how the patient should be knowing, so they know when their time is going to come. So in a crowded OPD, what happens, everybody is sitting together. So you will be giving patients at a 10 persons or 5 persons at a time, go to 5 different rooms, and then the second lot is sent in. Just like we are having our passport system nowadays, like in India, the passport system, how we are getting it in various places, that will also have to be started for the OPD screening right now, OPD things. The other is the separate sitting and social distancing, which is going to be a key. If you see these things, which are different colored seats, small measures, but can really be helpful so that you do not have people to be explaining to everyone out how to do it. If you have different colors or a paint on your screening benches, you will know that how much different and place distance of minimum 2 meters or 6 feet needs to be taken care by the people, or else you have some markings and signages there that people are not supposed to be sitting in these, and there has to be physical distancing. This is what physical distancing is being done right now in India. You can see the police people, how they are sitting on the benches with the masks on, sitting at the edges of the benches, making sure that the physical distance which we want is being maintained. In your hospitals, you will have to think of special lifts, which will be non-COVID or which will be used personally by the doctors or so, or some other patients. Something needs to be done regarding your lifts. And also inside the lift, you will have, not everyone is going to be there like the trains. You will have to ensure that people are standing separately. Give them some markers, give them signages, put them into your eyes and mind all the time that yes, they are in a zone where they can get infected or they can be a source of infection for others, which we think over the years we have lost the thinking about that. Visual measures, everywhere you find, you will have to have that washing area is on this side, hand hygiene, respiratory hygienes inside all your pillars, every signages, all the things need to be there in the waiting area. The monitors, the TV monitors need to be showing health hygiene, hand wash practices every time. And also alcoholic rubs to be there at every visible areas where you can find them, so that people do not have to be looking around once they feel and they are receptive for good education regarding their health at this moment. The other thing, which are small things, which I would say, you will have to wear off the glasses, which are steel glasses or glasses for the tumblers. They will not be used in the places. Most of the reading materials will go off from your waiting areas. Maybe only TV monitors will be there without any remotes, which will ensure that you are looking at the health education aspect whenever you are inside those waiting areas. Small things, but do think about them. It might be important. Use only disposable tumblers or disposable glasses. Use of maybe plastic or glasses made of wood, or I would say cardboard, are going to be increasing a lot. Proper signages and dustbins have to be there. The dustbin need to be pedal ones, the touch free, where you do not have any touch onto the dustbins. Small things, but will be important, and people will have to ensure these in their OPD areas so that proper safety precautions can be taken through the indirect transmission of this infection if it is there. Inside the OPD chamber, this is one of the things which was just shared with by one of my classmates, that they are having in the OPD chamber, you need to have proper ventilation areas, and the ventilation, the aeration has to be good. People are thinking of, not in maybe in our profession of orthopedics, but in other places where they have got small clinics where people are just sitting right in front of you, to have glass or acrylic barriers to prevent contamination of the tables of your office, which are being taken by the attendant. They pick out something from your table, look at it, look at the magazines, stuff like that. However, the CT MRIs can be a big issue, how to examine them, which maybe will go onto the electronic mode, and we will have to have a look on them at the computer at our places. Remember, the close contact period is not yet defined. How much time we need to spend with an infected patient to get that infection. Somewhere it is 15 minutes, somewhere it is 30 minutes, but still not known. So we'll need to be decreasing that close contact period if we are not having a proper personal protection equipment and the guards. We will have to maybe an OPD for a patient maybe needs to be less than 10 minutes or 15 minutes. That's what will be essential. Sanitization of the OPD area is going to be a big thing. You need to use only the hypochlorite or the alcohol-based drops. Start cleaning from the cleaner areas and then proceed toward dirtier areas. This will be essential. Have to inform and give this information to your sanitizing people. High contact surfaces like doorknobs, metal surfaces, computers, all these areas or the things have to be taken care twice a day. For metallic things, use alcohol because hypochlorite may not be good on metals. And always have freshly prepared sodium hypochlorite bleaching powder, which we are going to be using for disinfectants. If we look at the infective in-house patients, we'll have to admit to the hospital for a longer only if there is no alternative. And this will apply both right now and also with Corona when we are going to be living with them. Shift toward daycare surgery is going to be there. As people are in our hospital are also discussing that if you can do an arthroplasty within 1 day, which is sometimes being done and which is getting prevalent in most of the countries, we might have to do them in those settings only. And many new vistas will open now where people will go in for a daycare surgeries for many of the situations which can be possible. So what you need to ensure is the patient's movements have to be limited inside the hospital. The procedures may be shifted beforehand to the OPD settings or somewhere else, and then you shift the patient into your hospital. Remember that if your radiology, one CT machine is there and you have a person who gets infected and is taken that, you will have to sanitize that, and that sanitization might take you 2 to 3 hours, leading to a lot of hassles and backlog which will start continuously. The other thing which is there in the in-house or own ward patients is proper distancing will be there. You need to have at least 3 feet, 1 meter to 2 meters between the two beds needs to be there. Proper adequate room ventilation with huge windows if possible, if the natural ventilation is there. Or else at least 6 to 12 air exchanges out here, not like operation theaters with 25 air exchanges, but at least 12 air exchanges might have to be there in air conditioned places. For the for the constrained atmospheres where we might be working, maybe this is what the government has said for the people who are working, that you can use 3 to 4 exhaust fans driving air out of the ward into the natural atmosphere and the airs, so that the air circulation can happen away from the areas which are there into the natural settings. Think of these things because these are just a outlook at what all areas we will be needing to think about when we are working with Corona from the next time onwards. Inside the wards and the places, you will have to keep the patient's personal belongings to a minimum. I can assure you in many of the hospitals, we have so many things which they bring to themselves. You will have to be having a minimum of that. Sharing of equipments and the measuring things will have to stop. If possible, it has to be a patient-specific thing or a no-touch technique like a temperature by thermal gun. We all have been using the old thermometers, which might have to go out of fashion now in such situations. Good housekeeping is very important also in the washroom areas because sometimes the transmission can also, we do not know about the transmission yet, but it is said that it can be in the feces also. Have proper checklist for the housekeeping, just like we have it in our airports, in the hotels, where every time the checklist has to be signed, ensuring that proper sanitization and cleaning has been done as and when it was proposed to be done. Ward rounds. This is the crucial thing. I was discussing and thinking about how it is going to be done now. What we have done is that we have reduced the people who are teaching. The teaching has to change. It may not be the same that you do it on the bedside. The bedside time is going to be limited now, and more use of technology, monitor rounds, Skype rounds as they are called, might be the in thing now. You can be sitting in your room where the duty room is there, looking at all the x-rays beforehand, looking at all the reports beforehand, looking at all the temperatures beforehand, all the antibiotics which the patient is there. And then along with this lead consultant or a senior consultant who is taking care of that patient, the person who is looking after that, who is looking after specific areas, may be the only ones who are going and looking after them, so that they do not spread the infection if it happens. Because remember, in India right now, we are not testing the asymptomatic patients or any patient who does not have those correct indications as per the government guidelines. So you will have to be there. Which patient is positive or negative, you do not know. So these will be in place for some more time now whenever you are in your wards. Coming to the dressings will have to decrease. You will have they have to be minimum as much as possible. No daily dressing funda has to be there now. You will use modern dressings, thin transparent dressings, or foam dressings which can absorb the exudate and can be removed once and reapplied if required. Negative pressure, if there are wounds, you will have to put in so that the dressings can be frequently, of those dressings can be changed and you can prolong the intervals. Lot of ortho pads as we used to apply will not be a big thing now, because as soon as you remove them, maybe if the open wound is there, there can be some air turbulence and it can lead to some airborne droplets or so. The other thing is, whenever you are doing a dressing, you will, besides your gloves and mask, you will have to have a face visor in front of you. That's the bare minimum while doing a dressing, which you will have to do. Keep a record of all the professionals, healthcare who are coming on a duty, looking at a specific area, and also register screening and maintain a register for all the visitors, which will be definitely limited to 1 or 2, because if ever, God forbid, a patient is found to be positive later, so that you can trace back all the people who have been looking after that patient, because that is going to be a possibility when we are not testing each and every patient, and later on some patient turns positive, as has been happening over the last 10 to 13 days or 30 days, where people, and once a patient is infected, there are at least 20 to 40 healthcare professionals who go back and have to be quarantined. What do we wear? That's one thing which I would say for all. We are in medium risk personnel where we will be doing an emergency case for trauma or for patient contacts in OPDs and wards with dressings and the operation theaters. So we will have to have some sort of masks available, either at 995 or FFP2 or a surgical 3-ply mask which we are using. You will need to wear gloves for sure, which should be especially nitrile, because latex ones may not be so good with the chemicals and the alcohol which we'll be rubbing all the time. And for dressings part, we will have to be wearing the visors, which will help us to our faces from any of the fomites which can be transmitted to up to 2 meters of distance. So this is a bare minimum which people might have to be wearing many a times whenever they are in the OPDs or in the wards. In the OPDs, your receptionist and the security persons and the low risk ones will also have to wear a mask, and if possible, if you are able to afford a latex glove, also might be helpful for them. I'll end up this by saying that there's going to be a very fine balance in the time of Corona, when we are going to work with Corona, that we'll have to give and protect ourselves, our safety, along with the patient safety, and we'll have to have a fine balance between them in this era of Corona. And once we are able to maintain this balance, ensure our safety, which is also going to help us bring out the patient safety, that we will be able to give good services to our mankind. Thank you.